Question number 1. A 60-year-old man is being discharged from the post-operative care unit following a transurethral resection of the prostate. The nurse provides discharge information regarding the care of the bladder catheter. Which method would be most effective in bladder retaining for this patient? Options. Option A. Scheduled urination every 2 to 3 hours. B. Limit fluid intake before sleeping time. C. Perform pelvic floor exercises daily. D. Increase fluid intake during the daytime. Here the correct answer is option A. Scheduled urination every 2 to 3 hours. For bladder retaining following a transurethral resection of the prostate, scheduled urination every 2 to 3 hours is a method commonly used to help the patient to regain control over their bladder function. So this approach helps to prevent over-distension of the bladder and promotes a regular voiding pattern. Question number 2. While planning for discharge education for a mother about rickets, the nurse knows to include the need for appropriate food for the child. Which of the following food the mother choose for her child? Options. Option A. Potato and squash. B. Orange and tomatoes. C. Egg yolk and fish. D. Milk and yogurt. So here the correct answer is option C. Egg yolk and fish. So the foods rich in vitamin D include egg yolk and fish. Including these in the child's diet can help to prevent rickets by providing adequate vitamin D for the bone health. While potato, squash, orange and tomatoes are nutritious, they do not contain significant amount of vitamin D. Question number 3. A 67-year-old patient was brought to the emergency room with a history of diabetes mellitus, hypertension and heart failure. The patient complaining of acute shortness of breath and productive cough. The sputum was pink and frothy. During assessment, the nurse noticed crackles and wheezes. Blood pressure 80/45 mmHg. Heart rate 124 beats per minute. Respiratory rate 36 breaths per minute. Temperature 36.5 degrees Celsius. Which of the following disorder should the nurse suspect? Options. Option A. Pneumothorax. B. Unstable angina. C. Pulmonary edema. D. Pulmonary embolus. So here the correct answer is option C. Pulmonary edema. The patient's symptoms of acute shortness of breath, productive cough with pink and frothy sputum, crackles, wheezes and the presence of heart failure are the indicative of pulmonary edema. Pulmonary edema that is often associated with heart failure, and the frothy appearance of the sputum suggested there is a fluid accumulation in the lungs. It's also called as pleural effusion. Question number 4. The nurse is teaching 32-week pregnant woman how to distinguish between pre-labor or false contractions and true labor contractions. Which statement about pre-labor contractions is accurate? Options. Option A. They are regular and increase gradually. B. They are felt in the abdomen. C. They start at the back and radiate to the abdomen. D. They become more intense while walking. So here the correct answer is option B. They are felt in the abdomen. The accurate statement about pre-labor contractions is also called as false contraction or Braxton-Hicks contractions, that they are felt in the abdomen. The pre-labor contractions that are often irregular and do not follow a specific pattern. So they are usually milder than the true labor contractions, and that may be more noticeable in the abdomen. Question number 5. A postoperative patient has an order to discontinue the Foley's catheter at 11:30 am and a nurse removes the Foley's catheter intact. At 1 pm, the patient complains of feeling the need to urinate and voids 30 ml. The nurse should assess the patient for signs of which of the following? Options: urinary retention. B. Urinary tract infection. C. Cystitis. D. Hematuria. So here the correct answer is option A. Urinary retention. Urinary retention, that is the inability to empty the bladder completely, and it can occur after the removal of a catheter. The nurse should assess for signs such as discomfort, distension or a feeling of incomplete emptying of the bladder. Question number 6. A 6-month-old infant was brought by his mother to the child health clinic. A nurse assessed infant's growth and development. What is the infant supposed to perform at this age? Options. Option A. Shows gestures and signals. B. Attempt to crawl position. C. Rolls from prone to supine position. D. Communicates intentionally with verbalizations. So here the correct answer is option C. Rolls from prone to supine position. At around 6 months of age, the infants typically develop the ability to roll from their prone to supine position and vice versa. This milestone demonstrates the increasing strength and coordination in their muscles, and it is a significant achievement in their motor development. Question number 7. A 48-year-old man was admitted to the hospital with extensive anterior myocardial infarction. During the night, the patient was conscious. The cardiac monitor showed VF2 and the nurse checked the cardiac carotid pulse. Found no pulse. Which of the following is the best emergency management? Options. Option A. Cardiac thumb toys. B. Cardiovation 50 joules. C. Electrical shock 200 joules. D. Chest compression for 5 minutes. So here the correct answer is option C. Electrical shock 200 joules. In a patient with ventricular fibrillation and no pulse, then immediate and the best emergency management is to perform electrical defibrillation. So the recommended energy for the first defibrillation attempt is usually higher and commonly starting at 200 joules for in case of biphasic defibrillators if we are used. Question number 8. Which group of pediatric patient might feel hospitalization as a punishment for misdeeds? Options. Option A. Toddlers. B. Preschoolers. C. School-age children. D. Adolescents. So here the correct answer is option B. Preschoolers. Preschool-age children typically range between 3 to 5 years of age are at a developmental stage where they often have magical thinking and not fully understand the reason for hospitalization. So as a result, they might interpret hospitalization as a punishment for something they did wrong. So it's important for healthcare providers to offer reassurance and explanations to help these children to understand that they are not being punished. Question number 9. Which type of study design provides the strongest evidence? Options. Option A. Qualitative study. B. Randomized controlled trial. C. Systemic review of descriptive study. D. Systemic review of correlation studies. So here the correct answer is option B. Randomized controlled trial. So in randomized controlled trial, that are experimental studies that involve the random allocation of participants into different groups, one of which receives the interventions being studied and while the other serve as a control. So the randomization process that helps to minimize bias and ensures that any observed difference between the groups can be attributed to the interventions rather than other factors. Question number 10. An 18-month-old toddler returned immediately from the operating room after cleft palate repair. Which of the following nursing interventions should be considered? Options. Option A. Apply elbow restraints. B. Apply suction when needed. C. Measure oral temperature frequently. D. Position on the abdomen. So here the correct answer is option A. Apply elbow restraints. After a cleft palate repair, it is important to prevent the child from putting their hands or objects in their mouth, so which could disrupt the surgical site and affect healing. So applying the elbow restraints, that is also known as no-nos, that help to prevent the child from bending their arms and touching their mouth. So thereby we can able to protect the surgical site. Suctioning, measuring oral temperature and positioning on the abdomen are generally avoided as they can cause trauma to the surgical site and interfere with healing.